Let's learn about continuous glucose monitoring. So Dr. Obayashi, what is continuous glucose monitoring?
So continuous glucose monitoring is a great new tool that you can use to continuously track your blood glucose. I wore one a few weeks ago. It's great because without having to poke your finger, you can just measure your glucose. So we wanted to make the video to give 10 quick tips.
Okay, so number one, easy. Anyone can do it. So what you do is, it's a little device that goes in your arms, and you don't have to look at it constantly, but here and there you can actually check your glucose, your blood sugar, and see, hey, is it high, is it low? I'm not a diabetic, but I tried it. Knowing your glucose level, it's great because, once a year I could maybe do it 2 or 3 times, and then just check to see, hey, am I at a good level? It's a good thing to learn because, some people are pre-diabetic, they don't know about it, so it's easy, anyone can use it.
Yeah, no, I think it's great, and you can just buy it yourself. You don't need a doctor or anything, so about $110, you can just get it yourself. Mm-hmm. Sometimes there's promotions that make it a little cheaper.
Okay.
And so second point is the 5 roots, which is social connection, sleep, stress, nutrition, and exercise. And so all these different lifestyle factors do come into your glucose reading. And so you may notice if your stress is rising, that your sugars are starting to rise as well. And so it's a great way to kind of have a better insight into all your different lifestyle components.
Perfect. Number 3. Personalized. So with Biobi, first thing Dr. Obayashi does do is we do a intake, we do some blood work, he has a baseline for you. Next thing is based on, you can personalize yourself, Dr. Obayashi can help you, but certain foods, certain medication may increase this. So with this, it's very personalized to just yourself. No one has to see it, it's just you. If you want to share it with the doctor, yes, you can.
Yeah, and I think this is kind of part and parcel of the way we see medicine going, where it's going to become increasing personalized, unique. We get into genetics, and so healthcare, I think, will become more and more personalized to the individual person. So point number 4 is exercise snacks. And so if you do see your sugar going up, and typically with a meal, if it goes up by 2 or 3, that's okay. If it's going up by 4, 5, or 6, it's getting a little high, especially if it's staying that high up into the kind of 9 range. And so a good way that you can empower yourself to bring it down is with an exercise snack, which we did a video about.
Okay.
And so you can do 5-10 minutes of any exercise, and you'll see your blood sugar come down.
Okay. Number 5, easy. You plan ahead. So it's like when normal people do meal planning in a day. When I did the device, I noticed that white rice increased my sugar. So planning ahead is, let's say you go grocery shopping, you buy brown rice, or you meal plan ahead knowing that, certain things may bring it up, bring it down, so you plan based on that. So you plan ahead.
Yeah, because kind of like what's in your house, I end up eating. So if I can plan ahead and have a good grocery list, that helps out the next week. Point number 6 is intermittent fasting. And so it's something that we do encourage depending on your medical conditions. But intermittent fasting would be when you wake up from the time of your last meal, that it's 12, 14, 15, 16 hours. And so that fasting, which you don't have to do every day, you can do intermittently, does help with your metabolism using ketones as an energy source instead of glucose, which has a whole bunch of metabolic benefits. And so doing that intermittent fasting and then being safe and tracking it and seeing how your body responds with the glucose monitor on is a great tool for you to create more insight and intuition about your own body.
Okay. Number 7, fall slow. So sometimes you might look at the machines like, oh my gosh, I am low on something might be wrong. Actually, don't be alarmed. Sometimes it could just be as simple as, pressure on it. Like you were sleeping on your side, someone's leaning on you, it might read slightly low. Other thing is, sometimes when you're sleeping, your sugar might be on the lower end because you're not eating. But if you don't have symptoms, you have no history of it, don't be alarmed. But when you start to feel something's wrong, go see your doctor. And then the good thing about these devices, they have a very good return policy where they'll actually switch your product to do another one to make sure it actually is working.
Yeah, I think Debbie's talking about compression lows, which can happen. And also on the low side, these devices are powered on the low side so they don't miss any lows because it was developed for type 1 diabetes where you're on insulin and it's dangerous. If you get hypoglycemic events, you could faint. And so if you're not on insulin, glyburide, or glycoside, then it's unlikely that you're going to have significant lows that you have to worry about. I often tell people to turn off the alarms so they don't get woken up with the device overnight.
Okay.
Number 8 is false normals. And so there's a couple things that would make it so that your glucose looks okay, but the underlying metabolism's still not great, and that is with alcohol, because your liver and body can use alcohol as an energy source, and so it may not shoot your sugars up. And 2 is with ultra-processed foods and artificial sweeteners. Those are designed so that your sugars don't spike, but they're not healthy for you because it kind of overrides your hunger satiety hormone system, so you get hungry quickly.
Okay. Number 9, ordered eating. So, most people when they do, let's say, I'm going to give an example, like a dinner meal. Today, I'm going to have pasta, chicken, and a salad. Sometimes just the order of what you eat first can actually increase or lower your sugar. So the best way to do it is, like, sometimes I like to start with, let's say, my protein, my fat, my salad, and then last you eat your starchy, carby food. That's what usually will bring your sugar really high. But if you eat in an orderly fashion, sometimes your sugar might actually won't shoot as high as, if I start eating just rice first, or pasta as my example.
Yeah, that's a funny one because I used to, several years ago, not really pay attention to this, but eating a potato, fries, or something first actually has a big difference in your blood sugar. And point number 10, the last and final point, is know thyself, because that's what we're gearing towards, is for everyone to take care of themselves, have a better understanding of their own health, take your health back into your own hands, because I think as healthcare moves from healthcare 2.0 to 3.0, we're going to get more and more personalized, like we said before, and I think empowering people to take care of their own health with these glucose monitors as an extra vital sign is just one example of how we're doing that. So I hope that quick 10-point video on continuous glucose monitoring helped you, and feel free to try one on and talk to your doctor about it.
Okay, so thanks for joining Biobi Health. We're relaying medical information, not giving medical advice, so see your doctor or talk to your doctor.
Thanks for joining.
Thanks for joining.